Hello and welcome. Today we're diving into the fascinating, though sometimes irritating, world of ocular health to discuss concretions of the conjunctiva. What are they? Why do they appear? And what can we do about them? Join us as we unravel this common eye condition. So, what exactly causes these gritty little nuisances? Concretions of the conjunctiva are typically formed from accumulated cellular debris, epithelial cells, and mucus within the conjunctival crypts, also known as Henle's glands. Several factors can contribute to their development, including chronic inflammation, dry eye syndrome, aging, and environmental irritants like dust, wind, and pollution. Think of it as tiny pockets getting clogged over time. Let's delve into the pathophysiology. Imagine the conjunctiva, the clear membrane covering the white part of your eye, as a complex landscape with tiny valleys and crevices. These are the conjunctival crypts. Normally, these crypts are efficiently cleared by your tears. However, when inflammation or dryness occurs, the natural cleaning process is disrupted. This leads to a buildup of dead cells and other materials within the crypts. Over time, these materials harden and calcify, forming the small, hard concretions we're discussing. Epidemiologically speaking, conjunctival concretions are quite common, especially in older individuals. They tend to increase in prevalence with age, affecting a significant portion of the elderly population. People with pre-existing conditions like dry eye or chronic conjunctivitis are also more likely to develop concretions. While they can occur in people of all ethnicities and genders, certain environmental factors like exposure to dust and pollution may increase the risk. Now, how do you know if you have conjunctival concretions? Many people experience no symptoms at all. However, when they become large enough or protrude from the conjunctiva, they can cause a gritty, foreign body sensation in the eye. This can lead to discomfort, redness, tearing, and even mild irritation. In some cases, a concretion may rub against the cornea, causing a scratch or abrasion, which can be quite painful. The feeling is often described as having something stuck in your eye that you just can't get out. Diagnosing conjunctival concretions is usually straightforward. An eye care professional, such as an optometrist or ophthalmologist, can typically identify them during a routine eye examination. Using a slit lamp microscope, they can examine the conjunctiva and easily visualize the small, yellowish, white or grayish, white concretions. No special tests are usually required unless the concretions are causing significant corneal damage, in which case further evaluation may be necessary. While there aren't distinct classifications or types of conjunctival concretions per se, they can be categorized based on their size, number, and location within the conjunctiva. Some individuals may have only a few small, asymptomatic concretions, while others may have numerous larger concretions causing significant discomfort. The management approach often depends on these factors. Fortunately, treatment for conjunctival concretions is often conservative. In many cases, no treatment is necessary, especially if the concretions are small and asymptomatic. However, if they are causing discomfort or corneal irritation, they can be easily removed by an eye care professional. This is typically done using a small needle or other specialized instrument after applying a topical anesthetic to numb the eye. Artificial tears can also provide relief from dryness and irritation. In rare cases of recurrent or severe concretions, other treatments may be considered, but these are less common. Preventing conjunctival concretions entirely may not be possible, but there are steps you can take to minimize your risk. Maintaining good eye hygiene is crucial. Avoid rubbing your eyes, especially with dirty hands. If you suffer from dry eye, use artificial tears regularly to keep your eyes lubricated. If you're exposed to dusty or polluted environments, wear protective eyewear to shield your eyes from irritants. Regular eye exams are also important for early detection and management. The prognosis for conjunctival concretions is generally excellent. They are typically benign and do not pose a threat to vision. Removal of symptomatic concretions usually provides immediate relief. While they can sometimes recur, recurrence can often be managed with continued lubrication and occasional removal as needed. While research specifically focusing on conjunctival concretions is limited, ongoing studies on dry eye and conjunctival inflammation may offer insights into potential future preventative or therapeutic strategies. Always consult with your eye care professional for personalized advice and management of any eye condition.